everyone. I'm Mohammad Faruque. So I'm going to do a presentation on COVID-19 data visualization and spatial analysis. Let's go to the slide and let's get started. So in this presentation, we'll analyze COVID-19 data from 2021 using three maps created with Social Explorer, and we will discuss spatial patterns, trends, and implications. So let's go to my first map that I have created. So here's my first map. This is picture one. I have created total three maps altogether that shows different data about COVID-19. So in this first picture, in my first map, I showed cumulative number of confirmed cases as of October 24, 2021. And here we can clearly see the dark pattern, the state which is showing here, California, Texas, and Florida, that has like very, very dark pattern, which indicates highest number of confirmed cases in those states in USA. And then we can see New York here and Illinois here, and then Ohio, Pennsylvania, and Michigan that has like medium kind of dark pattern. So which indicates those states also got hit by COVID, and those number are also higher. But other state as of October 24, 21, uh, like Wyoming here or Idaho or like other state right top there, it shows less dark area, which indicates those states has less number of confirmed cases as of October 24, 2021. Let's go to next slides. Um, so yeah, basically map one, uh, um, map style shaded area. Yes, I have chosen shaded area pattern for this map one. Uh, Actually, from Social Explorer, the data it has, it don't allows us to choose bubbles or other patterns. So for this data, it only allows me to choose the shaded pattern. That's why I chose it. Uh, Also, I like this pattern because it's clearly shows the data and it's easy to understand from my point of view. So let's discuss about this one now. So basically, this shaded area styles allows us to see the concentration of COVID-19 cases across the states of USA, and it visualizes the severity of the pandemic. Explanation of category. So it measures cumulative confirmed COVID-19 cases in 2021 as of October 24. It shows total cases reported by each states, and now let's talk about patterns and story. So states with large urban population shows higher cumulative cases. And for example, like California and New York demonstrates the link between population density and spread. Yeah, we all know, like New York, Florida, California has a lot of population, and also like Texas. So those state was hit massively by COVID-19 at that period of time of October 24, 2021. All right, so let's go to the map number two that I have created. And map number two I have done, it shows the data about cumulative number of death as of October 24, 21. And we all know, it was a hard time in COVID-19. Uh, and we suffered a lot, we lose our family member. And if I personally talk, I also lost my very close relative, and it was very hard at that time. So yeah, we lost a lot of people in USA in that COVID time. So here in that map, it shows also like the populated area, like New York, Pennsylvania, Florida, Texas, and California has the highest cumulative number of death as of October 24, 21. And from the map, when I take that picture and I saw that Texas, it has like 70,593 people passed away by the time of October 24, 2021. And the number is massive. And that number is also very, very high in New York, Pennsylvania, Florida, Georgia, and also other state. Uh, though like those states like Wyoming or Idaho or Utah, the number are low, but still a lot of people passed away in those state. But the darker area here, those state has like massive number of people that passed away for COVID. All right, so basically, yeah, the shared area effectively convey the scale of impact through its dark pattern that we have discussed. And explanation of the category, it measures cumulative deaths related to COVID-19 in 2021 as of October 24, and it highlights regions most impacted by mortality. Patterns and story, yes, just like Florida and Texas shows higher deaths counts. And the most importantly, actually, this map, it indicates difference in healthcare capacity or public health measures of those greatly affected area, like California, Texas, Pennsylvania, Florida, or New York. All right, let's go to map number 3. So map number 3 I have created with the data of it shows the change of cumulative confirmed cases from previous week, which is which was October 24, 21, as of October 24, 21, and its previous week. So it shows the total confirmed cases changes in 1 week. And in this map, we can also see um, like California, same thing, California, Texas, Pennsylvania, New York. Um, New York, Florida has a lot of people. They were like affected with COVID-19 viruses, but the more bad thing was here we can see some new states that got affected very badly, which was like Michigan here, Washington right there, and also some other states. And that time the COVID-19 positive rate was going very, very high. And we can see only California in 1 week, 38,823 people had confirmed cases in just in 1 week. And that number was also very, very high in Texas, Pennsylvania, New York, here in Florida, Ohio, Michigan, like those kind of states, and it was really bad. Um, let's jump into map number 3, others thing to discuss. So here, map style, same thing. I choose shaded area. I couldn't choose bubbles or dot pattern because it didn't allow for this kind of data. That's why I choose shaded area. And also for shaded area, I mean, it's easy to understand, and it's easy to discuss. Also, this style effectively highlights the difference in case growth by color intensity. Yeah, that I have already discussed. Explanation of category. So this map measures the change in cumulative confirmed COVID-19 cases from the previous week. It provides insights into how the spread of the virus has evolved over the time, which indicates areas of concern. Patterns and story, yes, same thing. Areas with darker shade represent significant increase in cases, often correlating with outbreaks or spikes in transitions. States like California, New York, Michigan, Florida showed marked increase. Exactly. And most importantly, it suggests the impact of local events or policies on case trends. Let's go to next slides, which is spatial patterns and changes. Here, number 1, patterns reveal disparities in healthcare response and outcome based on geography. Number 2, over 2021, cases and death rose in some areas. And number 3 indicates a correlation between population density, state policies, and healthcare systems. Weakness of the maps. Let's discuss the weakness of the maps, which is modifiable aerial unit problem, or MOP, which aggregating data at the state level loses details that may reveal significant variations. Ecological fallacy. So assumptions about trends at the state level may not apply to individuals within those states. And also high vaccination rates in a state don't mean all areas have high coverage. Let's jump into the conclusions. So for the map I have used, these maps provide insights into COVID-19's impact across USA in 2021. Also it helps understanding limitations such as mob and ecological fallacy in crucial for interpretation. And this analysis helps to identify factors that shape the pandemic outcomes. Um, So that was all for my presentation about COVID-19 data visualization and spatial analysis. This is Mohammad Faruque again, and thank you so much. Take care.